Concept of health and disease according to Ayurveda. Our life is a long journey right from conception till death or even beyond. One is expected to achieve health, if not healthy, or is prone to disease, and further to maintain it through various factors. It is not only the well-being at the physical level, but even at mental and spiritual level. The mind plays a vital role, and as such, unpleasant mind indicates the state of disease or proneness to disease. Modern medicine has tried to understand a state of health or disease and or proneness to disease at the physical level through various objective parameters like blood pressure, ECG, various other pathological examinations, lipid profile, etc., or a more specific examination for certain disease like PAP smear, etc. No doubt, this to certain extent indicates health or disease state and or proneness to disease. But this identifies the status only at the physical level, neglecting the mental and spiritual level. Nevertheless, the causes of ailments at physical level have to be searched at all physical, mental or spiritual levels. Surprisingly, instead of finding out the causative factors and eliminating them as a scientific system based on causes-effects relationship, the modern medicine apparently tries to bring the things to a mean level with certain medications throughout the life. One or two examples will explain this phenomenon. The 40-up checkups are very common now, and they are expected to give a very good picture of health status and or proneness to diseases. This information available can be classified into four groups. 1. The person feels healthy with no symptoms of any diseases. The parameters like blood pressure, ECG, blood investigations, etc. are also at the mean standard level. The person is said to be healthy. 2. The person feels to be healthy without any symptoms of any diseases, but the blood pressure is above the average. The ECG shows some changes including abnormality. The cholesterol level is higher than normal, etc. The person is declared to be unhealthy or prone to various diseases and is advised medication for the whole life. Efforts are made to bring the objective parameters to mean average and then further maintain them throughout life with medication. 3. The person feels he is unhealthy with minor complaints such as loss of appetite and energy, sleep, fatigue, etc. But the investigations are absolutely at mean average and the physical parameters don't call the person either as unhealthy or prone to a particular disease. Neither he is investigated to find out causative factor for his ailments, nor is he given any medication to enhance his immunity to reduce the chances of getting a disease. 4. The person feels that he is unhealthy and the investigations also are not at the mean average level, indicating a state of disease or proneness to disease. It will be quite clear now that the modern method based on physical parameters to assess the health status is insufficient either to recognize the health status properly or to take proper measures to improve it based on cause-effect relationship, which is the basis of any science. The group 1 and group 4 at least match clinically as well as according to investigations. But as regards group 2 and group 3, there is a mismatch. Moreover, the Ayurvedic approach towards all these groups is different. In group 1, though the person is healthy clinically as well as investigation wise, a hidden threat in the form of heredity of diseases, addictions, psychological factors like stress, anxiety, depression, etc., and improper food habits may be present, making the person prone to various diseases. Also, there are chances that the person is health conscious and has very well maintained lifestyle to avoid these factors. It might also be possible that in the young age, person has put good exercise enhancing his immunity, and so even after consumption of causative factors or diseases, he still manages to remain healthy. So even in the first group, we need to examine the lifestyle and weigh the positive and negative points to declare him perfectly healthy or apparently healthy. In second possibility, he can still be prone to the various diseases and has to change the lifestyle to remain healthy. Group 4 people need thorough assessment through Ayurvedic aspect and that of modern medicine. But then we should reach the root cause of his condition, and this is to be found not only at the physical level but also at the mental and spiritual level, emphasizing on lifestyle. The lifestyle has to be changed along with medication. Ayurvedic medicine is more useful as it is having holistic approach, going to the root cause and more natural. As regards group 2, the lifestyle of the person has to be assessed to look for reasons for abnormal finding in investigations. One has to improve lifestyle in order to return to normalcy instead of having only allopathic treatment. Just giving symptomatic relief and not going to the root cause doesn't solve the problem. E.g., if regularity in food intake or work schedules is the cause for e.g., if irregularity in food intake or work schedules is the cause for hypertension or IHD, etc., efforts are required to correct the lifestyle. The Ayurvedic holistic approach is the better choice even in this group. As regards the third group, the modern medicine is unable to provide any assistance as it does not go to the root cause. Ayurvedic holistic management is a more appropriate choice as it goes to the root cause, finds out the shortfalls or improper food habits, etc., and suggests holistic management for a cure. In short, consideration of the patient as a whole with all lifestyle aspects is a must to know the health status and to improve it. Let us now try to understand healthy state, a disease prone state and a diseased state in Ayurvedic perspective. According to Ayurveda, Ayush or so-called life is a union of four factors: the body, the soul, the senses and the mind. Hence, to know the health status one should consider all these four factors. If all of them have good qualities, the health status is good and one lives healthy life of normal period of 100 years. But if one or more of them are affected due to various causes, depending upon the degree of disturbance, one is deprived of the healthy status to that extent. The reasons might be at the physical level, originating from the parents in the form of heredity, improper food habits during pregnancy, to the faulty lifestyle, improper food habits of the person, irregularities of food, sleep, etc., or at psychological and or spiritual level. We are a part and parcel of the universe and we influence each other. Carried away with the so-called concept of development, we have disturbed natural cycles, the ecology of the universe. This in turn has resulted in various ecological problems like urbanization, pollution, leads towards the various kinds of diseases. The whole society is thus affected, and being a part of the society, every individual is also affected. In a craze to minimize exertion or physical efforts, we invented many things. Electricity, electronics are being used in every walk of our life now, maybe in the form of automotive industry or air conditioning, mobile phones, electronic devices like computers, TV, etc. This has led to sedentary lifestyle and we have lost natural strength. This is also an important aspect at physical level. We use our senses for perception and senses for action throughout our life. But unlike a machine, we don't pay attention for their maintenance. A vehicle which may be used 2-3 hours a day needs servicing twice, thrice a year, and the wise people do it as a preventive maintenance. But the body which we use 24 hours a day, 7 days a week, is never thought of maintenance or relaxation. The proper use of senses either for perception or for actions with proper maintenance keeps one healthy, whereas overuse, ati yoga, less use, hina yoga, or misuse, mithya yoga, leads to diseases. This is why proper exercise, yogasanas, regular habit of massage for relaxation and for nourishment, servicing in the form of oiling is even better along with purification process, helps in maintenance of health. One is expected to be cheerful and happy throughout the life, but there are so many instances, small or big, which make us unhappy or dissatisfied. This leads to anxiety, stress, depression, etc. Ideally, one should accept any situation, analyze it without any bias, and never get stressed or depressed. On the contrary, one should think of ways to improvise the situation. If it is not possible, accept the situation happily and find ways for satisfaction, taking full precaution to protect self. Otherwise, ignore such situation or at least do not concentrate on it. It is better to concentrate on other things that will bring satisfaction. In reality, people don't try to come out of the situation. They neither accept it happily nor analyze it without any bias. No question of improvising it. As a result, they become victims of dissatisfaction, stress, anger, depression, etc., leading to many psychosomatic disorders such as cancer, heart disease, and diabetes. It is very well observed that psychology plays an important role in these diseases and have to be dealt with proper counseling. The soul is the living force. According to Hindu philosophy, especially Vedanta philosophy, the soul carries the impressions of the past life, of good bad deeds, purva karma. Health and diseases can also be associated with these good bad deeds. When no other reasons are found for serious diseases like cancer, etc., one may try to look for these deeds from past lives through the horoscope and try to improve it with some japa, etc., chanting of mantra. I came across a lady at the age of 58 years. She had recently lost her husband and she neither had children nor any relatives to look after her. Currently, she was suffering from severe arthritis and epilepsy. Her economical status was very poor and she was living in a single room where the toilet was 100 feet away. With the help of the small table, she had to crawl to the toilet. Due to arthritis, it used to take her half an hour to reach the toilet and another half an hour to come back. She was totally dependent on the neighbors for the daily needs of grocery, vegetables, etc. Moreover, her hand was burnt while roasting the chapati on stove due to an epileptic attack. To my surprise, her menopause occurred at the age of 25 years and she started getting epileptic attacks. A well-known allopathic doctor increased the dose of anti-epileptic drug to 25 tablets per day, but even that couldn't prohibit her epileptic attacks. When I visited her house for the first time, my first and last impression was that she was paying for the bad deeds from her past life. Even then, I advocated massage and some oral medicines to relieve her from arthritis. She didn't respond at all. After 2 months, she was taken to a charitable trust hospital where she was operated on spine. That worsened the situation and now she was completely bedridden and suffered from bed sores. When I made a courtesy visit, she burst into tears, cursing the destiny to keep her alive. Why God is not merciful and not taking my life, was her cry. This is a good example to know the role of the soul in our life. Another good example I could experience is from Germany. A kid of 4 years was suffering from cancer of the urinary bladder. He was about to die within 2-3 days and was referred to me for consultation. His main complaint was pain in legs. Whenever he used to wake up, he used to cry. The doctors had done a vein section in the abdomen and had put a morphine ampule. Whenever the kid used to wake up and cry, the parent's job was to press the morphine ampule. With this, he used to become drowsy and sleep again. There was absolutely no quality of life. The parents even could not talk to the child. No question of feeding. When I reached, he woke up and started crying. I gave him a gentle massage of lukewarm olive oil and he could sleep without morphine. When I interrogated his mother, it was a strange story. She said she had lots of stress during pregnancy and she smoked heavily, 30 cigarettes a day, even during pregnancy. She had guilt for that, as her child suffered from cancer right from the birth. Now she was pregnant again, running 7th month, and to everybody's surprise, was smoking again during pregnancy to get relieved from the stress of this kid. You alone are not at fault, I said to her. That really surprised her. as everybody was blaming her for smoking in the previous pregnancy and even for the current pregnancy. Look, if we consider the destiny of this kid, he has received a life of 4 years only. That is also a miserable life. Moreover, though he is also a sufferer, apparently it is not his fault. This is not justifiable in the law of cause-effect relationship, and one commits a mistake and another is a sufferer. So his fault has to be traced to the previous life. Maybe after paying off for his bad deeds, he may have a good destiny for the next life or for liberation. It was the stress and smoking during pregnancy which invited such a soul with very bad destiny. In order to avoid such incidents to happen again, you should stop smoking with immediate effect. I said to her. Fortunately, she followed my advice and the next baby is healthy. This boy survived for 15 days as compared to 2-3 days expected life with better quality of life. The massage could reduce the pain and produce sleep even when his father did it. Then he could have a few sips of milk boiled with gold. This was kept ready on my advice. As he expressed the desire to eat something due to hunger, he was given this milk. This really added quality to his life for the remaining days. These two cases are enough to explain the role of soul in our life. One will realize that all these four factors, viz., body, soul, senses, and the mind, are required to be considered either for maintenance of health or for getting a disease or getting cured from it. Unfortunately, the approach most of the times is in parts, and even then the whole is not covered. Even at the physical level, we don't try to reach the root cause like the lifestyle, the food habits, etc. As a result, the society is unaware of various factors. Even when they know these many factors, they are reluctant to follow the rules and put restrictions on them. Basically, one should be able to differentiate between a short-term pleasure and real long-term pleasure. Investing in health is making a provision for long-term pleasure. But we are fond of various things. We are addicted to various things, which we know as bad for our health, but still we do not refrain from them. We also know various things which are good for us like healthy diet, exercise, yoga, etc. But due to lack of urgency and consistency, we don't really follow them. This program will guide you about what is to be followed and what is to be avoided. I don't say that you don't have even the short-term pleasure in your life at all. The unhealthy pleasures should be restricted to once in a month or even less. One should emphasize on improving immunity through exercise and yoga so that you don't suffer from the unhealthy pleasures. Addictions have to be got rid of anyway. The more difficult part is the psychological aspect. Stress, anger, anxiety, depression, jealousy is very difficult to control and to get rid of. With the continuous efforts and also with the help of yoga and counseling, one is able to conquer these factors successfully and can remain healthy. Thus, the questionnaire on the website www.gadgilayurveda.com www.gadgilayurved.com is designed in such a way that all these factors are covered in the proper way and health status can be known with the holistic approach. This minimizes the risk of missing something very serious. This will definitely help the society to become aware of the health status and improve it. At least those who have already suffered from or are already suffering from the diabetes, cancer, heart diseases, and its complication like kidney failure will realize and welcome this holistic approach. It is the lack of this knowledge and awareness that leads them to such a suffering. Now they can become aware about the health status and improve it to prohibit the recurrence and complications. Moreover, they can guide their next generation to become aware right from the beginning and take steps to prevent the primary onset. The society will be benefited at large by becoming aware about health status and by putting appropriate efforts to improve the health status. Let us create a healthy society.